Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the pharmacology of the loop diuretics. The loop diuretics work in the thick segment of the ascending limb of loop of Henle. The loop diuretics are the strongest diuretics. We have commonly used loop diuretics are the furosemide, ethacrynic acid, torsemide, okay, and bumetamide, okay. So we got the common loop diuretics. These are the furosemide, ethacrynic acid, torsemide, bumetanide. Okay, we got that. All of them are with DE. This is acid. This is MIDE. This is bumetanide. Okay, we got the loop diuretics. So the site of action is very important. Site of action is the thick ascending limb of the loop of Henle. Limb of the loop of Henle. Okay. So if we go there, we'll go. This is the epithelial cell of the ascending limb of loop of Henle. Epithelium of the thick ascending limb of loop of Henle. Okay, or you can say thick ascending loop of the loop of Henle. Okay, very good, we got that. So this is our kidney. Kidney is this is kidney. Kidney has around 1 million and over nephron, and nephron has Bowman's capsule, the proximal convoluted tubule. Okay, then the descending limb of loop of Henle, thin segment, then ascending limb of loop of Henle. Okay, then we have distal convoluted tubule. Okay, we have the thin segment, this is the distal convoluted tubule. Okay, and this is the collecting duct. So site of action is in the thick segment of ascending loop of Henle. So we got site of action is here. This is present in the medulla of the kidney. This part is the hyperosmolar part. This is the cortex. That is the isoosmolar part of the kidney. So we got the site of action. Now, what is the mechanism of action? That is important to us. Mechanism of action. If we go there, if we go to look at that, this is the thick ascending limb of loop of Henle. We can make it a little bit thicker. Okay, so we can make it this way. Okay, so this is the thick ascending limb of loop of Henle. Ascending limb of loop of Henle. The part of the nephron. This is the nephron. This is the unit of the kidney. in each kidney we have around 1 million nephron. This is the proximal convoluted tubule, the distal convoluted tubule. This is the collecting duct. Okay, this is the Bowman's capsule. We have the glomerulus, efferent vessel, Bowman's capsule, proximal convoluted tubule. This is a thin segment of loop of Henle. This is the loop of Henle. Okay, we got that. So how the loop diuretics work? Suppose the furosemide, we have the torsemide, we have the ethacrynic acid, we have the bumetanide. Okay, so how it work? This is the most commonly used loop diuretic. Market name is Lasix, very popular brand. Okay, so how it work? In the epithelial cell of the thick ascending limb of loop of Henle, here what happened? We have the sodium 2 chloride, potassium symport. Okay, so these are co-transport system, sodium 2 chloride, 1 potassium going inside the cell. The loop diuretic actually block this entry. So as a site of the furosemide, it blocked that part. It blocked this part. Okay. So if it block this part, what will happen? Then what will happen? Sodium and chloride will be increased in the lumen. This is the lumen of the lumen, means this part. This is the lumen. Okay, this is the lumen. So lumen of the, this is the lumen. Okay, this is the distal convoluted tubule. Our site of action is the thick ascending limb of loop of Henle. This is the lumen. So this is lined by the epithelial cell. This is the epithelial cell. These are the cuboidal epithelial cell, one layer cell, and we have the sodium 2 chloride potassium co-transport system on the luminal surface of the epithelium that is blocked by the furosemide or ethacrynic acid or bumetanide or torsemide. Okay, then what will happen? So there will be excessive sodium and chloride in the urine. Okay, so mechanism of action. So sodium 2 chloride and potassium co-transport is blocked. Co-transport is blocked. Then what will happen? There will be excessive sodium and chloride. Okay, sodium and chloride will be in the urine, in the lumen of the thick ascending limb of loop of Henle, will be in the TAL, thick ascending limb of loop of Henle. This is the process of formation of urine here. Okay, so excessive sodium and chloride will be there. Okay, so there will be potential difference, and potassium inside the cell, they will come back through another channel. Potassium is coming out to the lumen, so there will be a positive side here, negative side here. There will be potential difference from this luminal surface to the interstitial or para or the basolateral part. There is potential difference. This is positive, this is negative. This will happen. Okay, so if this is positive, potassium is coming out here, that's why it is positive. It will block the paracellular passage of calcium, magnesium and sodium. Okay, so there will be potential difference between the luminal surface and basolateral surface of the epithelium of the thick ascending limb of loop of Henle. That will happen what? That will inhibit paracellular diffusion, of what? Of calcium, magnesium, and what? And sodium. So we got the mechanism of action. Blockage here. Excessive sodium chloride. Potassium again coming back here from the inside the cell. Okay. So what will happen? There will be potential difference between this side and that side. This is the luminal surface. This is the basolateral surface. This is towards the interstitium. Blood vessels are present there. So due to potential difference, there will be inhibition of calcium, magnesium, and sodium through the paracellular diffusion. So this is the mechanism of action of the loop diuretics, like the furosemide, ethacrynic acid, torsemide, bumetanide. Okay, this is the mechanism of action. Okay, we got that. Now, what are the therapeutic application of the loop diuretics? So, therapeutic application. Okay, therapeutic application, most important in case of pulmonary edema. Due to heart failure, any other edema like that of cirrhosis of liver. Okay, that is also another indication in the management of any type of heart failure, especially congestive heart failure. Okay, it is a management. Acute renal failure, cirrhosis of liver, in cirrhosis of liver, usually the furosemide is given along with the potassium sparing diuretic, that is called spironolactone. Okay, so cirrhosis of liver. In the management of hypercalcemia, in case of hypercalcemia, because it passes the calcium through the urine, hypercalcemia, that is an indication. Okay, so it is also used to manage hyperkalemia. Okay, we got the use: pulmonary edema, hypercalcemia, heart failure, hyperkalemia, acute renal failure, and certainly anion overdose. What is that? Overdose. This happened due to accidental intake of iodide, bromide, fluoride by a person. Then we will have problem that is called the anion overdose. In that condition, this is the medication for that, the loop diuretics. So we got the therapeutic application: pulmonary edema due to heart failure, due to any cause of heart failure, acute renal failure, cirrhosis of liver, any type of edema, hypercalcemia, hyperkalemia, anion overdose due to accidental intake of fluoride, bromide, iodide. Okay, so we got the therapeutic application. It is very commonly used medication. Okay, to manage the generalized edema. We got that. Then we'll go to the pharmacokinetics. This drug is absorbed very quickly. Its duration of action is only, so it is absorbed quickly. Okay, it has two type of preparation, parenteral or intravenous. Parenteral, intravenous, IV, and also like usually intravenous. IV are also oral preparation, and duration of action is only 2 to 4 hours. Duration of action is 2 to 4 hours. Okay, and this drug is excreted through the urine. Okay, this is excreted through the urine. Okay, that is the pharmacokinetics of this drug. Okay, now what are the adverse effects of loop diuretics like furosemide, bumetanide, ethylpranic acid, torsemide? What are the adverse effects? Okay, it's very important. We are looking at here, potassium is lost, so there will be hypokalemia, sodium is lost, hyponatremia, hypovolemia or hypotension because blood volume is lost. Around 25 to 30% of sodium chloride is usually absorbed at that site. Okay, so we are blocking this part. There will be hypotension. Okay, then we'll have the potassium depletion, hyperuricemia. So hyperuricemia, so that happens because uric acid cannot be excreted properly. There will be competition between the loop diuretic and the uric acid for the site, the acid forming site in the nephron. Okay, so there will be hyperuricemia, that is a possibility. Okay, so there will be volume depletion, and regarding calcium, it may cause hypocalcemia. In certain situations, it may even cause hypercalcemia if there is severe dehydration or renal insufficiency, metabolic alkalosis. Okay, that is a possibility. Okay, metabolic alkalosis. This is one of the important adverse effects of this medication. Hypomagnesemia, we are losing magnesium. Hypomagnesemia. Okay, we'll add one important adverse effect, that is the autotoxicity. That is very important. Okay, we can put it in the number 1 in our list. Okay, 1, 2, 3, 4, 5, 6, 7. So autotoxicity is very common, especially due to disturbance in the potassium transfer through the inner ear. So there will be cochlear damage. There may be eventually the vestibular damage. So cochlear damage in the inner ear initially, then vestibular damage, person cannot maintain balance, eventually vestibular damage. This all happen due to abnormal movement of the potassium through the membrane inside the inner ear. Okay, so we got the autotoxicity, and you must remember that autotoxicity will be more if we use some other drug like that of the other medication that also cause problem in the ear, like that of the aminoglycosides, like that of gentamicin, okay, amikacin, tobramycin, kanamycin, streptomycin. So that will lead to autotoxicity. It will increase autotoxicity because they also cause autotoxicity. Okay, even some anti-metabolite, some type of anti-cancer drug may also enhance the autotoxicity. Okay, so autotoxicity may happen with that of the loop diuretics. Okay, we got that. Then we have to know some of the, we have discussed autotoxicity. It may also be caused by some anti-metabolite like cisplatin. Cisplatin is a drug, anti-cancer drug, that also causes autotoxicity. If we add two drugs together, loop diuretics plus the cisplatin or loop diuretic plus the aminoglycoside, there will be more and more autotoxicity. Okay, we got that. Now we have to know some drug interactions. Drug interaction. This drug depends on the prostaglandin for its function and secretion. So there will be drug interaction with NSAID or any other drug that suppresses the prostaglandin. Okay, this drug has interaction with aminoglycosides like that of gentamicin, like that of streptomycin, amikacin, kanamycin, tobramycin. All the mycin group of drug, aminoglycosides, will interact with this drug. Okay, and anti-cancer drug will interact with this drug, cisplatin. Okay, this drug goes nicely with that of the other diuretics that may enhance its action. Okay, and we must remember that for the control of blood pressure, the thiazide diuretic is the choice. This drug may also decrease blood pressure in case of excessive fluid in the body due to renal failure or some other reason. Okay, so we got the drug interaction. Contraindication. Contraindication. Our drug, except the ethacryonic acid, all of them are structurally close to the sulfonamide. So contraindication is rare. Okay, rare. It may be contraindicated if sulfonamide toxicity, sulfonamide hypersensitivity. Okay, we got that. So we got the contraindication. It is rare, not always common. It may cause dermatitis, interstitial nephritis, bone marrow suppression. That is possible. Okay, and that's all about the pharmacology of the loop diuretics. If you like my video, please support my channel, share the information with your friends, and please subscribe me. Have a nice day. Bye now.